This is an example of the shock absorption of the lumbar spine or the lower back. Notice in the blue structure, which is the disc, notice the nucleus in the middle, which acts as a pivoting mechanism, and this video is cycling through different degrees of thinning of the disc. So it shows you how the disc is prone to breaking down. This training is going to be teaching you how to keep this from happening or minimizing the breakdown or loss of the disc thickness over time. Okay, next we're talking about the lower back. How to train and manage your lumbar spine or the lower back. And when you look at somebody's spine from the side, there should be a forward curve in the neck and a forward curve in the lower back and a backward curve between your shoulder blades. When you look at the spine from the front, it should be nice and straight from your neck down to your tailbone. But most people don't think much about the fact that what's normal in the spine when it comes to the neck from the side is a natural arch with your neck going forward, going back between the shoulder blades, and then going forward in the lower back. That's what gives your spine a resilience, a shock absorptive quality, and that's what we want. So today, on this video, we're zooming in and focusing on the lumbar issues or lower back issues. And the reason I stress this concept about why it's important to have this lordosis, this lordotic arch, is because all of the different techniques that I teach, the different back maneuvers or stretches or exercises that I teach, are all about maintaining that natural lumbar arch. So when you look at the spine from the side, we're referring to this as the lumbar area. So what's very important, I've put together some sheets of information on the lower back, which you can get these handouts at our office, or we can email them to you. And this is titled Lower Back and Lumbar Spine Issues. So we're going to touch on some of the key points. And again, I'm not going to read this whole handout to you, but I'm going to use it as a guide. Most lower back problems are self-inflicted. I find that most of what people do in life is either helping their spine remain structurally healthy or breaking it down. Most people don't think much about how they do things. In fact, they don't think about it because they don't realize that it is adding to their problem without them realizing it or not. Most people do not make the connection. They don't connect the dots. When they have pain, they wonder about what they did right then that caused the pain. What you should be asking yourself is, what have I been doing over time that's set the stage for my lower back to be injured or be hurt? Because usually the activity that finally triggers the pain is activity that has been breaking slowly down, breaking the integrity of the disc down little by little. I'll be showing you some video clips of how the disc is prone to breaking down. If you take a section out of the spine and open it up and look inside, I'm going to show you some models from a bird's eye view about how the disc fibers tear, the outer ring of the disc. But first we're going to talk about what not to do. When you pick things up, always remember this simple rule. People often remember this rule when they're picking up something heavy, but they assume that if it's a very light object, that it's okay to bend down. So people tend to bend down like this to pick things up. Big mistake. What I teach everybody is, no matter how light the object is that you're picking up, even if you're picking up a pencil off the floor, do not bend down to get it. Now, you would think that's common sense, but it's not. Most people think, well, if I bend down to get it and my back doesn't hurt, what's the problem? What they don't realize is that they are running the risk of getting what are called micro tears. Remember, when you're bending down to pick up a pencil, you're still lifting half the weight of your spine from your waist up. So remember that. It doesn't matter necessarily how heavy the object is. So one key principle I teach is, use your spine as if it's an elevator rather than a crane. Okay? So as you go through life, most of the time you want to avoid bending forward. You want to avoid bending it like a crane. You want to most of the time, keep this somewhat vertical like an elevator. So if I'm going to pick something up, I'm going to support and go down like this. Or I'm going to put one hand down and pick it up and I'm not going to bend down as much. So I'm going to always practice keeping this section somewhat vertical all the time. If you can remember that one trick, that can make all the difference in the world. It's a small thing, and it takes a while to break out of old habits. I see people all the time who come in here with back pain. I give them all the best teaching, all the best training, and we do therapies, we do traction, but then I see when they pick up their purse or pick up a pencil off the floor, they just bend right down and they forget everything we've talked about. So this is not a very easy habit to break. Once you have been in the habit of lifting incorrectly and you've done it long enough, this habit is very difficult to change. I can give you many, many examples over 25 years of practice. One great example comes to mind of a lady who had multiple herniated discs. She had 2 substantial herniated discs. I looked at her MRI, I really thought that she would need to have surgery. In fact, I encouraged her to consult with several different orthopedic surgeons. We'd already done an MRI scan, confirmed she had 2 herniated discs, but she was adamant about not having surgery. So we did traction and decompression therapy on her, which worked beautifully. I was really surprised that her spine did finally stabilize, and I kept giving her this lecture about proper lifting technique, but she was out of pain. Now, when people get out of pain, that's when they're most vulnerable. We become complacent. We tend to go back to the old habits that got us in trouble in the first place. So, this is a great example because it was a sheer coincidence that her family happened to rent a house directly next door to where I used to live, over on Lorraine. And sheer coincidence, they rented the house next door. So I had given this lady my standard lecture about be careful, be careful, be careful. She was doing much better, and that's when I really remind people to be careful. The next day, I gave her this lecture on a Friday. The very next day, on Saturday afternoon, I happened to look out my front window in my house and saw this lady and her husband planting flowers in their front yard. And I'll never forget, as I watched her, this was the day after I gave her this lecture, this lady that's this close to surgery, and there she was, the poster child for how to herniate a disc. Her legs were locked and she was doing the windmill going up and down, planting this flat of flowers. What was really odd is her husband was standing there watching with his hands on his hips. And so I thought, okay, this is too perfect. I walked down to the front yard and chuckled and said, boy, you picked the wrong person to move in next door to. And it occurred to her, and we all laughed awkwardly, and it occurred to her what she was doing, that she had cycled right back into her old habit of bending down, and the worst possible thing you can do is repetitively bend and twist, bend and twist, bend and twist. And once it occurred to her what she was doing, she handed her husband the flowers and said, here, you do it. But it taught me a very important lesson. Here's one of the most extreme examples of somebody who should be careful, who literally had forgotten everything we talked about the very next day just because she was out of pain. So it taught me a lesson. It taught me that human beings are very prone to going back to their old habits when they're not in pain. Pain is a powerful motivator, but when it goes away, we lose our motivation. We're not reminded. So you may hear me remind you many, many times to use your spine, especially your lumbar spine, more like an elevator than like a crane. Do not crane it forward. Keep it upright. Now,